Hey, good afternoon, everyone, and thank you for joining us today for our webinar on showcasing your skills for career transitions in global public health. This event is being organized by the Georgia chapter of Women in Global Health. My name is Bijal Dalakia, and I'll be your moderator today. I serve on the advisory board of Georgia chapter of WGH, and I'm also the founder and managing director of Afia Insights, which is a healthcare and market research company based here in Atlanta. So I know some of you already know Women in Global Health, and some of you may not. So here's just a very quick introduction. It's a global network of women working towards health equity and supporting women's leadership in global health. We have presence in 52 countries, and there's 57 chapters, of which the Georgia chapter is one. And here in Georgia, we actually hold a number of events in the Metro Atlanta area focused on supporting health equity and advocacy and mentorship for our members here. So if you'd love to join, we want to have you on board. It's free to join. You'll end up on our mailing list, and you'll learn about events that we are holding, which includes our May social, which is coming up just right around the corner. So we'd love to see you guys there. All right, so back to our webinar. So we are going to be discussing career transitions in public health, and we're thrilled to have two dynamic speakers with us today, Kashmira Date and Agnes Trent McIntosh. I'll introduce the ladies in just a moment, but to give you an idea of our flow of our conversation today, we're going to have Kashmira discuss her personal career transition journey. Agnes is going to talk a lot about how to, strengthen your personal brand and provide tips on that. And then we'll have a short segment on how to improve your LinkedIn profile, which I'll be leading towards the end. And as well as Q&A throughout. We'll do the Q&A at the end, but as your questions come up, please feel free to add them to our chat window here. All right, and so to our speakers, Kashmira Date is Senior Director in Medical and Scientific Affairs for the Respiratory Vaccines Division of Pfizer. She's also VP of Healthcare at Business Women's Associations, and that again is the Atlanta chapter. And Agnes is a career development coach, and she also works with Children's Healthcare of Atlanta. So Kashmir and Agnes, welcome, and we're really thrilled that you're joining us today. All right, so perhaps we could kick off with Kashmira. Maybe you could talk to us about your personal career transition, how you moved from the public sector to private sector, and what you learned along the way.
Absolutely. So, thank you so much, Rachel and Maria and everyone at NBGL at the Women in Global Health, Atlanta, Georgia chapter here. So thank you very much for having me. First off, I just wanted to, I know that, we have a lot of folks here who have been looking at this, unprecedented situation right now of these career transitions and where things are. So first and foremost, I just wanted to acknowledge that I know this is a really really difficult time for many of us in who've been in this sort of public health space, and just wanted to acknowledge all the difficulty in terms of like navigating this situation right now. So I mean, I'd love to hear from you actually what some of the questions are, but I can tell you a little bit about my journey, and anything that you find might be helpful as you're thinking about the situation, navigating the situation. Happy to help, sort of think through that process. So, very quickly, and Bijal, thank you very much. You already introduced me. I'll talk a little bit about my public health journey before I transition over to, how I made that transition into the private sector, and what I've been doing and what I've learned along the way. So, as some of you may already know, I was at the CDC for a long time. I'm a physician by background with training in public health. I did CDC's Epidemic Intelligence Service Fellowship under, our most coveted, our most admired leader, Dr. Steve Thacker, Maria, we are very, very grateful for that training that we had under Dr. Under his leadership. So I did that, back in 2008 to 10, and then transitioned into a staff epidemiologist role at CDC. What, many of our colleagues here have been working in that sort of public health, epidemiology, data, policy space. And so I was there for almost 12 years. I was within the global immunization space and worked on new vaccine introduction for several years before I made that transition into the public sector or into the private sector. But even within my public health journey, I mean, one thing that I did even before I came into EIS into CD, at CDC, I actually also had an opportunity to work at a state health department for a few years. And I think what sort of defined my journey is to it didn't really pan out the way I wanted it to pan out, but just sort of like going with the flow in terms of where things were going, what I was seeing as opportunities, what was interesting me, and just kind of went with that flow. Um, and so during the pandemic, so I was actually working at CDC's global immunization program for almost 10 years before of course when the pandemic happened, all of us had to make that shift in terms of the response and all of that. So what happened at that point with me, I was working in a particular area in that sort of new vaccine space, and I wasn't sure if some of my skills would transfer over into like what was needed for the pandemic response, what was but I just kind of took that leap of faith, and many of us had to sort of step up in that space, and very quickly discovered that many of those skills, those foundational skills that we have in terms of um, approaching a problem, looking at the data, using the data for decision making, those were like foundational skills that applied into many of those areas that for disease prevention and control in public health. So I think that was really helpful for me to sort of think about where I stood from that sort of skill set perspective and where I wanted to grow. What were some of the learning opportunities for me? And when that happened, I mean, of course, this was a time when the public sector, the private sector, everybody was coming together to sort of be into the response phase and seeing where the needs were and what was needed. And at that point I was already starting to think about, and not exactly similar, but it was an unanticipated situation that I found myself in, where I wasn't quite planning on moving into the private sector yet, but as things were happening and I was approached, I was talking to people, this opportunity opened up. So I actually went to Johnson and Johnson as the global medical affairs lead for vaccines within their global public health organization. And as I was looking at that transition, what really helped me was talking to people who had made that transition, what worked and what didn't work, because this was a whole new world, right? Like, I mean, having been on the public health side of things, the private sector was not something that I had explored, so didn't really know what to expect. Um, but what really helped me was having those people who provided me some of those insights, but also, the good and the bad. So it's, I think one of the things that I had to like very quickly understand is that the private sector is extremely dynamic. Things happen so quickly, whereas I was more used to that stability before. So that was a huge lesson learned very, very early on in my journey of that transition. But what really helped me was also having those mentors and those colleagues who had experiences on both sides. I mean, I think it was, I have to say that it was kind of a humbling experience, because initially when you go in, you're like, I've done all this work and I mean, I have all this tremendous experience. But then when you move into a different sector, it's just, having to take that step back and to say, wait a minute, I mean, I really don't know so much about this sector. So people who had made that transition, but also people who had always been in that sector. It really helped me to talk to some of those people because I wasn't entirely like, sometimes I would hear things and I'm like, that is really not making any sense to me. But, then to kind of have those one-on-one connections, having those conversations to understand, okay, where are you coming from? What is it that I'm missing? So I think that sort of like, having those conversations, those connections, really, really helped. But I do want to say that when you're making that transition, again, having a very open mind about things that you know and things that you don't know, and most importantly, things that you don't know are extremely important. The other thing that I just wanted to, and Bijal, please, feel free to interrupt me or, if I'm going over time, let me know.
No, you're
A couple things, a couple things that I just wanted to sort of highlight. So the networking piece of it comes to mind, right? Like, I mean, because and again, I think the situation may be very different, but I think some of those attributes and lessons learned might really apply. Um, if you have the opportunity, I think I just kind of jumped in and started doing things again. It was a different time because time was of the essence. Everybody was in that sort of like response phase with the pandemic. Things had to just happen, so there wasn't very much time for that sort of like learning, taking a step back, understanding things like that. But the networking piece, that's where, as many people say, and I was told that quite a bit in that realm, that network before you need it, and very often in the private sector, like when I went there, I was like, oh, this is going to be a while for me. I'm going to, this is what I want to do now for the next whatever time or number of years. But, people are already thinking ahead of, what do I want to do next? Where do I want to grow? What do I want to do? So that was a mindset shift for me to say, oh, this may actually not be as long term as I'm thinking because things shift all the time. So, but starting to network, just getting to know people. Hey, like this looks really interesting to me. I don't fully understand based on your title what you're doing. So can I just like, just out of curiosity, can I understand what you're doing? And I'm just curious and I'm just really interested in knowing more about you, about your journey, and about what you're doing, because there may be things that and I'll talk about one experience that I had where things just opened up a whole new world for me just because of that curiosity. But yeah, I think it's very difficult when, and I don't want to just say that it's impossible, especially because we all understand it's a very different situation right now. But just approaching someone to to get a job, it's not, it's not exactly that sort of networking that you want to do. I think what you want to do is to really understand that space, before you are in that crunch of having to look for a job. And so I think that was really important. I think one of the challenges that I had, and it took me a while. I've been here now for 5 years, so I wouldn't say that this happened right away. But it's so it was definitely challenging to sort of make that mental shift. But again, I think what really also helped me was that understanding that there's a lot I don't know. I want to grow, I want to learn, and just having those sort of like attributes in your mind about growing and learning and starting to establish those connections. There's a lot, I mean, I made a lot of mistakes, and I don't think one thing that I learned very quickly is to not beat yourself up over those mistakes, but to learn from those and to move on. And how do you not make those in the future? But also it helped me discover myself a lot more, just in terms of what is it that is really bringing me that energy, uh, where, like, who am I and what do I want? Where is my true passion? Where is my flow? And sort of navigating through that space was interesting, not something that initially I was prepared for, but something that I kind of like really helped me get to where I am. And it's evolving, right? It's a journey I'm still going through that journey and understanding my space and myself and my environment and my colleagues and my mentors and coaches. And, often people don't understand the difference between who's a mentor, who's a coach, who's a sponsor. And so, like really starting to understand that space and what brings you energy. Um, I thought that was really helpful for me. So maybe I'll just pause here and see if, there's anything you want me to add or any other, yeah, insights.
And yeah, I was going to say that the networking thing is just so invaluable. You hit the nail on the head there because I've had two major career transitions myself, and in the first one, I moved from working for a pharma company in the UK to coming to Minneapolis, where there were no pharma companies, and I was, initially very stumped. I didn't know what to do. This is in the days before LinkedIn, so there was no kind of online networking per se. And so to your point, I after kind of a few months of getting nowhere, luckily Minneapolis at that time had a professional networking group, so I joined them. And like as you said, it's all about being curious. It's about meeting different people, asking them questions. Not everyone's kind of ready to, hire you for something, but your goal is to go learn to understand what else is out there. And I initially ended up doing a job as a content writer for an orthopedic company. And then from there, I moved to doing healthcare market research. So ultimately, I stayed in my space of healthcare, but the journey was kind of, it was evolving through my networking. So really appreciate your thoughts there, Kashmira.
Absolutely. Maybe I'll just add one more thing as people are looking for, that immediate advice because, there are now, you've been like thrown, many of us have been, or many folks have been thrown into the situation. And I kind of went through a transition even within the private sector, right? I mean, I think again, that sort of understanding of things move very, very quickly. There are business decisions made that are beyond, your, I don't even want to say control, but beyond where, you have that even influence or understanding of where things might be going. But I think, one thing that I was really helpful for me is to know, even when that shift happened, I wasn't yet ready to move in, like, I mean, it's not like, there are jobs just like there out there, right? And many like you'll see, and I think we do that in either of the sectors, that do you have experience in this sector, and our immediate reaction is to say, well, I don't, right? And you don't. And so I don't think that we need to make things up or whatever, but I think it's really important to look at the job descriptions and the company information very, very closely. And when we say the private sector, the one thing that I've learned, again, you talked about pharma, Bijal, but there is a whole consulting world out there, all the private consulting companies. And we work even in on the pharma side of things. I'm working very closely with a lot of consulting companies, because again, like it's always like there's always a need for efficiency, being lean and mean, so you only have a few of these what we call as full-time positions, but then a lot of the work gets done in collaboration, or with these other consulting firms, or with these other contractors, companies that you can work with, and get things done. The other thing is, also look at, when I say job descriptions, so I'm a medical epidemiologist, right? And so the first thing that was a natural sort of fit for me was in this medical scientific affairs world, which was very similar to the work that I was doing. So it wasn't a big shift. It's not like I had to get a whole new degree, or I had to get a whole new experience. So that was a good shift. But even then, I learned that when you move into, when you come from the public into the private sector side of things, there are a lot of things on the compliance side, on the regulatory side, on the legal implications of things, that there are things that you can and cannot do that you used to be able to do before in your other role. Now, the scientific affairs, the medical sort of like, work kind of remains similar, because it's all about the data. It's about data generation. data dissemination, things like that. And so that did help me. But then I also realized that there are other roles that might be quite helpful for people to look at. So, if you're a medical epidemiologist, or, if you have like the data skills, you can look at real world evidence kind of roles. You can look at the health economist kind of roles, what they call as health economy and, economic and outcomes research related stuff. So, so I would just don't go by the title. There are clinical developments. If you do have some, clinical trial experience, um, things that you've done in that sort of world, you can look at some of those roles as well.
Thank you, Kashmir. That's super useful, to understand that, don't get hung up on the title of a particular job. Just look at the description, look at what the skill set they're asking for, and you might find that you've got a good match between what you're capable of doing and what that job is offering. So thank you for that. Um, I'd like to move on now to Agnes, and if we could talk, really about personal branding, Agnes, that would be awesome. If you'd go
Oh,
ahead, please.
okay, thank you. And I was just nodding the whole time that Kashmir was telling her story because she just hit everything that is so important, which I call is like a multi-prong approach, really, for when you're thinking about or in the middle of career transitions. And Bijal, thank you for introducing me. I just wanted to clarify that I actually am a point 0.8 FTE, if you guys know the FTEs, at Children's Healthcare Atlanta. I actually helped start launched a career center for internal mobility for them 3 years ago. But I also have my own coaching business called Career Rescripted, because I like to think of careers more like holistically instead of just a string of roles. And it's funny because you don't think about this until you kind of connect the dots of looking back of your experiences. So I think it's really important to pause and like think about the themes and patterns that you have had in your work. And so that's how I kind of tell my story. And that's what got me into career coaching myself. A theme that has come across for me is learning and coaching and developing. So I love that you have this learning community. You all have like a connection and with a common interest in global health, but also of course, the career growth part is integral to this as well. But so I actually started my career, and I would say there were some like pivotal moments, and I would say these as what Kashmir had alluded to. Some of the climate that we're in right now. Bruce Feiler, this author, he talks about life is in the transitions, and he talks about life quakes. Sometimes they will happen like maybe every 18 months, 3 years, sometimes like major quakes, like in 10 years. And then there's things that we kind of think of as work quakes. We are kind of in the middle of this, and the ripple effects that it has, not just in the global health world. Think of all the areas that I would usually talk to my coachees, and I've had over 1,500 sessions, coaching sessions. I would say the areas too that are adjacent to global health, and like higher education or the healthcare field. It's kind of having ripple effects with the funding, with opportunities right now. And I don't say that to be discouraging, but I want to put kind of some reality into that. But going back to when you're in a transition, Rollins School of Public Health, where I actually did my degree, it was in international health at the time, so I'm kind of dating myself. One of the important things that happened to me there was someone from Save the Children, the chief medical officer, came to Rollins and was telling us about a study that they were doing in Vietnam. I studied international health. I did maternal and child nutrition, and they wanted someone to do a follow-up study. Well, that follow-up study led to a $1 million grant for USAID that went to Rollins and also to Save the Children. And I feel like it's come like there have also been a lot of like full circle moments for me. And so one of the things is that really sparked my interest in the work that Save the Children was doing. And later I find out that it was featured in a business psychology book called Switch by Chip and Dan Heath. And so I just felt like you just never know what those opportunities will lead to. And I didn't find out about that till 20 years down the road. So I spent 5 years in nonprofit world. I got to travel a lot early in my career. And then for circumstances that led us back to Atlanta, where my husband grew up, we moved here for his career for Department of Justice. And after 7 years living here, they closed the Atlanta office. You would not believe like how glued we were to C-SPAN, to Eric Holder talking about what was going on there. So, so he did a transition to the Department of Treasury for 3 years. And then after 3 years, he wanted to, he has his own business. So he does wills, estates, and trusts. And I say that because you just, you don't know what the world will bring you and what's going to happen there. But going back to what skills and things that I brought, I want to go back to the networking piece, because that really got me back into, I did a decade detour at home. I call it when I was had my kids, and it was really hard when I was trying to come back into the workforce. It was in the middle of the recession, so not a great time to be looking for a job. And I didn't go back into the public health field. I found a job through a connection with a technology firm. And I was doing all the training coordination for Apple, Facebook, Google. And for me, it was, all of a sudden I was back, and I really questioned, like going back to what Kashmir was saying about like imposter syndrome. I didn't think I had some of those skills, and it was such a different, move into that area for me. But one of the things I will say is then I went to higher education. That was my next move. And then to Children's Healthcare of Atlanta, which I felt came full circle because I started my career as a research assistant at Children's Hospital of Philadelphia. Now, when I work with my coachees, there are, I think, certain things that really stand out that people who navigate their career really well. And one of them is curiosity. Having curiosity, not with an end goal, not with an outcome, but kind of being invested in the process and the progress of growth, right? And what I would say is you can think of the people that are in the areas or industries or roles that you're curious about, think of them as your culture interpreters. In leadership development, there's a book about the first 90 days. And that's one of the things that they really stress, that for your learning curve, getting into a new industry. I would say also do some career creeping on LinkedIn. You can look up people, you can see how they brand themselves. Like I would say maybe for when I was looking at your role, your background, Kashmir, maybe award-winning physician scientists. I work with some people who are, we would say maybe senior public health expert or youth advocacy. There are certain things that you can bring into your branding there. And the other tips I would say for career transitions, and Rollins did a really great job about this. They had a webinar where alumni were coming together, and some of the things that they said you should consider, and I will expand on some of this, is consider your personal needs and values. This is a time where you can stop and pause. And I like to ask people, what is your timeline for change? Sometimes you don't have that luxury. Sometimes it's not by choice, which is never a good feeling, right? But what I would say about that is it is a time to think about not only what is your timeline for change, what do you hope to get in your next opportunity that you're not currently getting? Some of these could be, these are what I call like your drivers and job satisfiers. Maybe you have 20 years of experience, but maybe it's really 1 year experience 20 times repeated. Maybe it is, you need variety. in your job. You know, there's research that says you need like 20% variety in your job. The other thing is thinking methodically about your transition. And when I say that, it's put some structures and systems in your place, just like utilize your research skills, start a spreadsheet, do what Kashmir was saying about the networking piece and also the job descriptions that you're interested in. What the job description says isn't exactly what the title is. I know there are over 14,000 roles at Children's, and it's, you know, the more you talk to people, the more you realize how the role will give you more role clarity. So what you want to do is just, you know, look on job description. How excited are you about it when you read it on paper? From scale 1 to 10, does it look like a 6 or 7? And then how do you feel after talking to someone? And when what I like to say is focus on, I call the 3 I's. Who can you go to for information, insights, and inspiration? And some of that might be reconnecting to former mentors or former colleagues. And then while you're doing that, I would say part of your branding and part of kind of moving into that role is think about your LinkedIn profile as a living resume. There's a great course, there's a LinkedIn Learning course, and if you guys don't have LinkedIn Learning as your learning management system in where you work, you can get it free from the library. There are certain courses I think that were very helpful. One that I just listened to today, and it's called Making Recruiters Come to You by J.T. Donald. And she just talks about everything that we may not get into the weeds of today, but about the resume, the LinkedIn profile, about recruiters and what the expectations of working with them. And she talks about just also showing like your interests, like who do you follow, the companies, because when you start following companies, that's showing interest in a company. When you join community groups, that is showing interest. And recruiters like to see some activity. You don't have to be a thought leader. You know, 70% of people on LinkedIn are passively looking for jobs. Maybe 1%, just like any other social platform, are thought leaders, and maybe 10% are, you know, comment here and there. The rest, they call us LinkedIn lurkers. But basically, so some of the skills I would say that are, one of the newsletters that I follow is the Learning Blog on LinkedIn. And then they named the top 24 skills of 2024. And they use their algorithm, the power of everybody on LinkedIn, to see like what were the skills that people were posting that got them jobs, that their title has changed somehow. And so some of the skills are communication, customer service, which I think of as stakeholder engagement. And even if you switch, I think in our heads, we build up like, oh, we're moving from the public sector to the private sector, but it's not that big. You're just moving in a different area. So your learning curve is the content, and you're going to have different stakeholders, but it doesn't mean that disqualifies your work or your experiences. Other skills are leadership, project management. Project management is huge because that is where you, everything is project-based work. So if you're going to do something on your resume, I think key things to do an overview at the top. Don't do an objective. Do connect the dots of your experiences in like 3 to 4 sentences. Front load all the information on your resume. Do a skills and attribution section. And this is where you should do like 9 skills. And don't bury the lead. Don't put like 36 skills up there. You can put more skills on LinkedIn, but I would say for that is a cleaner, and that kind of guides the hiring manager and the recruiter to like, these are your areas of expertise. Other things are analytics, management, teamwork, sales, problem solving, and research. So these are all skills that you bring with you. It's not a new language that you are learning, okay? But I think what Kashmir had said, you know, looking at the job descriptions and looking at roles and companies that you like, you'll start getting that language of the industry that you want to move into. And then what I would say other skills to highlight: change management, adaptability. I was looking up an article about like AI and job searches. And some of the things, if you're going to stay like in business operations and you have like the public health arm with business operations, other things you might want to highlight is performance metrics or operational efficiency or strategic planning, conflict resolution, effective communications, technology integration. Think of all the things that we have to do. You know, you might have a different technology that you're using, but you're still using that in your work. And I would say process optimization, resource allocation, and guess what is at a top skill too? Is storytelling. A lot of people don't think about that, but I think one of the mistakes that I have seen that people do on their resume or even in their profiles, they overemphasize their technical skills. I think you need to balance your technical skills and your soft, or what they call power skills, hand in hand. Okay, and then have stories that demonstrate those across your experiences, so they can connect the dots of what you have learned along the way. Um, are and let me see. So, are there any other questions, or do you want me to address them at the end, Bijal?
Well, yes, we'll certainly do a Q&A session
Okay.
towards the end, but I was
Mhm.
wondering, Agnes, what kind of advice do you have? You've given us some great tips on how to, uplift our resumes and our LinkedIn profiles and how to make them, just that one notch, two notches better.
Mhm.
But how do we maintain sort of that authenticity? How do we avoid kind of sounding almost fake as we are updating our various online presence?
Yeah, that's a really good question. I think what happens is, it, like I said, like using your LinkedIn, thinking of LinkedIn as a platform like your living resume in terms of connecting with people in the area. Like one of the suggestions that I think really work well, because, in reality, think about how you've gotten your different roles. Sometimes sometimes you don't know anybody in the organization, but most of the time, 75 to 80% of the time, it's because you knew somebody that could help, elevate your application there. So one of the things is, even before you are looking for a job, um, connect to people. You might have, if you're on LinkedIn and you look on, the dashboard that says like people under an organization, see somebody that went to your school, or maybe you worked together before and you didn't know that they had moved to another area that you're interested in. I think one of the things is you can do that, the self-branding part. And I know for some people that feels inauthentic, right? But if you are doing that, if you're really, if you do that in all aspects of your life, for me, like coaching and developing, consulting, and that's my branding on there. And then also social entrepreneurship. I give 15% of my proceeds go back to a scholarship in my mother's name. Um, what I would say is, I think you can also tell your story there, your origin stories of your career. Or for me, my family came here from Vietnam. I was 18 months old, and we just we just had the 50th anniversary of the fall of Saigon. So I think reinvention was already kind of part of my story there. And so I think that is something like, what are the themes and patterns that go throughout your career?
Thank you so much, Agnes. This is super helpful. And we're gonna, obviously there's tons of questions coming in through our chat. So we'll have certainly more questions for you in just a little bit. So let's kind of move to our next segment now. And we are going to in fact, we're picking up on some of the themes that Agnes has just been talking about and looking at some quick tips to improve our LinkedIn profile. So let me just share my screen with you for a moment. There we go. Okay, so we've just got a couple of tips coming your way. We do have a tip sheet as well, and Rachel is going to be putting a link to that sheet in the chat window. So here's, it's on your screen at the moment, but you can now download it certainly. So not only does it walk you through different sections of your profile and some of the things you can do to improve it, but we've also got some links as well for you to do some additional reading, kind of along the lines of what Agnes was just talking about. All right, so, revising your headline. This is, something very simple, but what you want to do is demonstrate your value proposition, your expertise. So don't just have the job title that you currently have or the job title that you're seeking, but tell a story about yourself in terms of some of your key skills, who you are, some strategic words. So you could be a Africa health policy expert. You could be a HIV malaria program manager. If you have a key certification, so, project management certification, you could put that. And nowadays, I see this increasingly, people tend to put a little bit about themselves to demonstrate who they are, their personality. So this ties in with what Agnes was talking about in terms of remaining authentic. So, don't be afraid, because this is not your resume that's going specifically for a job application. This is more a living document, as Agnes pointed out, where you can demonstrate who you truly are. For those of us like myself who have a name that is a little bit atypical, LinkedIn now has a sort of microphone feature as well, where you can record the pronunciation of your name. So feel free to do that as well. It's super helpful for others who look at your profile, who want to reach out to you and they don't know how to pronounce your name. Overhaul your about section. This is really the story. This is what will hook a reader into who you are. So describe a pivotal professional moment, something that reflects on your character or your work ethic. Talk about some of your skills or achievements, but keep it succinct. If you've got some numbers that you can share about, projects managed or healthcare statistics that you've contributed towards helping, feel free to include that in. But this is your chance to kind of really define yourself and put your best self out there. And it's really your first impression. This is what's going to grab the reader to decide, are they even going to bother reading the rest of your LinkedIn profile? So on the right-hand side of your screen are some sort of, some words that you can use in your about section. I create, I scale, I implement, I deliver key outcomes, I build amazing teams, I've aligned, I've led, grow, my key strength is X. So, I want to pause and tell a little story here. I have a colleague or a good friend actually, who works in the power industry. And so her headline says, that she's a space enthusiast. So immediately you're kind of a little bit curious about this individual. And then when you read her about section, she talks about all the work that she has done. She talks about, the key skills and attributes that she has. And she finishes off with a fun little statement about, I want to bring power grids to Mars when we're ready to colonize it. So it gives you a sense of flavor as to who she is, what she's about, and what her ambitions are. And that would certainly intrigue somebody looking at your LinkedIn profile and go, this person's a little bit different from everyone else that I've looked at so far today. Maybe I should reach out to them. So something that's, tells a little story about your personality. Add skills and recommendations. So LinkedIn has a nice little sort of section where you don't have to think of the skills that you could add. You could kind of come up with some keywords and it'll give you some suggestions of what the skills are that you could add to your profile. And these are kind of the keywords that employers may look at, when they're trying to filter through various resumes that they have and various profiles that they're looking at. So feel free to add skills. But also, if you have skills there already, review them. Get rid of things that are old. You might have put down something like, I'm, experienced in Word Perfect or something from, 15, 20 years ago. Well, nobody really uses Word Perfect anymore. So don't be afraid to get rid of things that are in your profile. And then prioritize your skills. So the ones that are most important, push them up towards the top. You have an option to kind of, use your mouse and kind of move them forward. And those are the ones that, will be seen on screen at first blush. So make sure that your most important skills are showing. And then try and get some endorsements from or recommendations from colleagues or even from fellow your peers, folks that you know along, who know you fairly well. Don't be afraid to give them pointers about what skills or what characteristics you want them to emphasize in their recommendation of you. That's perfectly fine. You can give them some advice. So here's a little snippet I picked up from a website, and it said, "I had the pleasure of working with X on several projects. Their exceptional attention to detail and problem-solving skills significantly contributed to the success of our team. Um, she's a great team player, and I highly recommend them for their outstanding work and collaborative spirit." So this kind of, again, tells a story about what kind of individual you are in a work environment. So, put something like this in, get some endorsements, get some recommendations from people who can kind of tell the story of who you are. It's kind of like a reference, essentially. And then check, and recheck. So check for consistency. Make sure that your formatting is, consistent. You're using bullet points, not some square and some round. Avoid excessive jargon. Avoid, spelling mistakes. Read out aloud. That's really a good way of checking that everything flows. And try AI tools. If you write a section about yourself, describing the work you've done for particular employer, or maybe it's even for your about section, run it through ChatGPT and ask it to come up with a more succinct professional version. You may not necessarily like everything that ChatGPT or another AI tool gives back at you, but it's still going to give you some good pointers on how to enhance your LinkedIn profile. So, don't be afraid to use AI tools. And then make sure that you're checking for consistency. So if you're applying for positions, you might already have submitted your resume. Make sure that the resume and the LinkedIn profile are somewhat consistent and they don't sound like two entirely different people. Now, obviously, the LinkedIn profile is a broader document. You're showcasing a broader range of capabilities, experience, and skill, whereas the resume is kind of fine-tuned towards a particular job opportunity. But you still want things like dates and job titles and employers that you've worked with, all of that to be in sync. So again, it doesn't sound like you're two different people. So that kind of brings me to my session, and I want to now just open it up to having some Q&A with Kashmira and Agnes. All right. Okay. So one of the questions that popped up earlier was, how do women, particularly younger women who have young children, do you have any special tips or advice for them as they're looking to do career transitions? So I don't know, Kashmir or Agnes, if you want to jump in there.
Actually, a full circle moment for me when I said I took my decade detour. I didn't have all these tools before for connection, for research, for everything. So that's what I wish I would have had. But at Children's, we actually have a Mom Force program, which for eligibility, if you have been out of the workforce for 3.5 years, you have to have an internal resource, and you also like apply to the roles too. So they try to match you to different areas. So for that, I do talk to a lot of people, which I call like in different life phases. I call it starting up, slowing down, and everything in between, which is really switching up, right? And so sometimes it is about work-life balance. And And I was wondering, like, with the role clarity, do you mean to find roles that are more conducive to working remotely? Um, or do you mean how to balance everything? Because it can seem very overwhelming, like it's its own job to find a job, right?
Exactly, exactly. And in these kind of challenging times, there's a kind of a desire to, if you feel your job is not secure, you want to kind of jump to the next thing, but you've got to kind of carefully balance what you move to, if particularly if you have a young family and you have certain constraints.
Mm. I think what happens is that intentionality is really important. Were
Mhm.
you gonna say something?
No, go ahead, Agnes, you finish, and then I'll just add something to that as well.
Oh, no. I think if it's important to have a flexible schedule, there is a way when you look up in jobs in LinkedIn, you can look and you can filter it by different things. I would do, and think of it, if you were about to do like an industry jump, think of it, you're at your discovery phase. So you're still figuring out what's the right search terms, right titles. Like, say you're a public health journalist. I was working with someone the other day. Maybe science communicator might be a different kind of adjacent, like more broader term. So you have to think of your role a little bit broader. Or maybe, or someone had asked in the chat about what roles you could be looking at, like health scientists is a role that I see a lot, or healthcare analysts, or healthcare consultant, or without the healthcare, but just health consultant, or research consultant, or research analyst might be good roles. But so you do up there, so you're still figuring out your search terms. Put in, like, you can do the job notification to set on or off, and you want to filter it by like roles within like the last month, I would say, for one of the days. You can also filter by hybrid roles, remote roles only, and you could also do it by company. And if your company that you're thinking about, I always say, regardless if a company is hiring, what are the 5 companies or 10 companies that you would be so excited to work for because your missions, your values align with their mission, right? So you can add the companies that you are looking for, even if they don't have any job postings out there. And then you can set the job notification. That's one way that you could do that. And find people in your community, because there's so many other moms or other parents that may be in the same boat. It's just a matter of, you have to signal that you would like support and find people who will be part of your support squad.
So, I mean, I'll just quickly add to what Agnes said already. I think, just know, right? I mean, and I was nodding too when you were saying a lot of things, Agnes. Um, it's the same kind of, like, we are the same people everywhere, right? I mean, these are, whether you're in the public sector, private sector, you have a family, you have children, you have elderly parents, there are caregiving responsibilities that so many of us have. So I wouldn't let that sort of deter you from looking at, as Agnes was saying, the job that you really are interested in doing. In fact, in the private sector, one thing that I found is there are a lot of these organized groups called ERGs. So, it's the employee resource groups. In fact, you'll see a lot of these employee resource groups. I'll talk about one of those that I'm a part of, that Bijal you mentioned in the introduction, called the Healthcare Business Women's Association. So these are all women, where we have some of the same challenges, some of the same, things that we are all dealing with and working towards. And so, in fact, I found a lot of support in these kind of organized groups. We had a lot of discussions about, moms, people coming back from maternity leaves, or, after having taken a break and then coming back, and how can you be integrated into the workforce? So I would absolutely encourage you to look at all of these different situations and not let that discourage you.
I'll just say one more thing. There was a mom's working group that I was part of that dissolved as our kids got older, and somebody is just rebooting it now. So maybe you could start a mom's group or find something online.
And ladies, to that same effect, do you have advice for those who are kind of more in their mid-career and have, been very successful in their position for 20, 25 plus years or so, but they're now having to thinking about pivoting or maybe being forced to have to pivot? Any specific advice for them?
I can start, and then Agnes, feel free to chime in. Well, first off, I do want to just mention this is something I should have said in the very beginning. Like the standard disclaimers that we all do. That all opinions are my own. It's not. Nothing in terms of my employer sort of situation. But yeah, I mean, I think one of the things for mid-career, and because I made that transition during that phase, right? Again, I think it comes back to all of the principles and mindsets that we talked about in terms of having an open mind. You may have been in this tremendous, leadership position in your previous role, but when you're transferring into a different sector, just have that humility that you may not actually be able to transfer. Again, it's not a one-to-one kind of match there that, like this is the level that you come in at. So I think just keep an open mind. Look at something that really excites you. You may actually have to go a step below or something like that. So, again, look at it as an opportunity for growth, to learn something new, to transition into a different, sector, and get to that point. So, because I struggled with that a little bit in the beginning. It's like, am I at the right level? I had all this experience before, but now it's not exactly the same, and I kind of feel like I know a little bit more here or a little bit less there. So, just again, have that open mind. What has really also helped me is having a tremendous team. And Agnes, you talked about teamwork and, having a team around you. The one thing that I kind of came out of this whole thing is to, in my own, just for myself, to say that I do not want to be the smartest person in the room, and I do not want to feel like I'm the dumbest person in the room. So I think as long as I have that, where I'm learning and I'm contributing, it's really made me feel that fulfillment in my job, in my career.
Thank
I
you.
actually, oh, thank you, Kashmir. I actually did a podcast. I call it like these past 3 years have been little tiny experiments to see what I like or not. And one was being a guest on my friend's podcast called Midlife Mojo. And I actually addressed that same question that you just had. My friend Lisa Dupree and I, her podcast called Midlife Mojo. So if you look up my name, I just did this last year, but we talk about like, well, I think reframing, just like you were saying, Kashmir, like your mindset. And you have to ask yourself, do you want to keep continuing doing the things that you did before, or do you want to do new things? Because I worked with someone who she could have gone to like the next level. She was looking for an executive director role. But she said, Agnes, I could do this, but it's a startup and it's nonprofit. And I feel like I would be the chef, the sous chef, the front of house, and the dishwasher. And I don't think I want to do that at the point. So again, look back at the themes and patterns of your work. And not only that, get granular. Like for one of the things that I've done in the past is launching programs. I think that's what helped me get my current job. But what is the part of it? I like the launching part. And so maybe you've done some of the program coordination or implementation, and maybe that's not something you want to do more. Maybe you want to be on the consultative side of that.
Well, fantastic. Thank you so much, ladies. We have a ton more questions, but we've kind of run out of time. Thank you again for helping us with this webinar and for all the advice that you've given to our attendees. I'm sure everyone's truly appreciating everything you've shared with us. Just kind of finishing off here today to say that, Women in Global Health have got a event coming up in May. It's our spring social, so we'd love to see you all there. And thank you again for joining, and thank you, Agnes and Kashmira.
Thanks for having us.
Thank you for having us. Thank you.
Take care, everyone.